The University of Guam School of Nursing Dean Margaret Hattori Uchima and Guam Memorial Hospital Nursing Director Zinnia Pacina are here to fill us in on a very exciting training that is happening for nurses from Pohnpei. So welcome, ladies. They are both nurses.
Yes.
Welcome.
Thank you. Thank you.
And so maybe you could tell us more about this very exciting program partnership between UOG and Pohnpei.
Well, the University of Guam, we have what's called a AHEC grant, Area Health Education Center grant. It's funded by the U.S. government. And we've had this grant for 9 years now. And one of our centers is actually in Pohnpei at COM FSM. So we had a meeting there a couple of years ago, 2 years ago.
Mm-hmm.
Nice. And we always tour the hospital, and I had a chance to talk to the nursing administrator there and some of the nurses, and they really brought up the issue of needing some training. And part of the AHEC mission and the University of Guam is to reach out into the region and to help provide some staff development.
Right.
And one of the goals of the AHEC grant is what we call practice transformation. You know, what can we do for nurses, other healthcare workers, to improve the quality of care for patients, you know, for people. And there's a strong philosophy that if you can improve healthcare in the region, it will benefit Guam, because a lot of people from the other islands come to GMH and come to Guam, maybe in need of medical attention. And if you can improve the health situation in their island, you know, that will only benefit us in the long run. Correct.
Right, of course. And I mean, that translates very nicely to healthcare here on Guam. And maybe you could tell us more about why it's so important to train these nurses and what type of training they are getting here.
Yes. Well, you know, GMH is like the vehicle, and it's giving them the opportunity, the Pohnpei nurses, the opportunity to receive some training, some clinical hands-on training. And, you know, we were very thankful when the dean actually asked us, would we be willing to help with the training? We're like, absolutely. I mean, the GMH, for one, has worked collaboratively with UOG for many, many, many years. Mm-hmm. And we're kind of like the training ground. So when this opportunity came, it's like, sure, why not? So we actually flew to Pohnpei. We were able to assess the hospital just to see exactly what would be needed in order to help the nurses in Pohnpei to reach their goals. And so there were many, many opportunities that we identified. We met with several of the nurses there and several of the leadership. And so we came up with this great project. And for, you know, people, when we brought it back to GMH, some of the nurses asked, they said they thought it was a really great project. Mm-hmm. And I think what's really beneficial for our hospital is, you know, we provide the training to the Pohnpei nurses, and in exchange, because we take care of a lot of the patients from the other islands, right, it would be a chance for them to teach us a little bit about being more culturally sensitive, since we do have patients from the other islands.
Right, there, yes, you go, kind of like a win-win where you're learning from
Absolutely.
Each other.
Yes, right.
I love that. And yes, so maybe you could tell us how many students, how many nurses you have in the program right now.
Well, we have 6, 4 from the hospital, from Pohnpei State Hospital, and 2 that are from the school, the College of Micronesia, FSM. Nice. So they have a nursing program there. And so one teaches the nursing assistants and one teaches the RNs.
Perfect. So they're going to also be going back to Pohnpei to bring that knowledge to the places where they are working. Is that correct?
Yes, yes.
And we were very fortunate, and I'm so sorry I forgot to mention it, that our UOG Endowment Foundation actually has a fund set up, a scholarship fund. It's named after Dr. Charles Parent. Unfortunately, I never met him before I came back to Guam, but he had passed away. But he worked at public health for many, many years, loved Micronesia, and really wanted to set up a fund for Micronesian nurses to get their BSN, their Baccalaureate of Science in Nursing degree at the university. And so we don't have that many Micronesian students. We just graduated 2 Chuukese nurses this past year. But there was excess money. And so the foundation was wonderful. They said, come up with a plan. So we wrote a proposal and presented it to the UOG Endowment Foundation board, and the board approved it that night. And so and we know that this is in the spirit of what Dr. Charles Parent would have wanted us to use his funding for. But it's a great example of, you know, being able to leverage the resources and to meet the mission of someone like Charles Parent, a donor who wants to see their money go to good use. And this is a great You know, because
Right.
GMH doesn't have a lot of money. We're well aware of that.
Right.
And you know, the university also is also sometimes strapped for cash. So to be able to leverage something from such a valuable resource, you know, and where also the philosophy matches what we wanted to do. You know, we're so proud that the UOG Endowment Foundation Board agreed to fund this.
Of course, and also in light with UOG's mission, I mean, we cover a lot of that service-oriented aspect. And so finally, I just wanted to know quickly what this would mean going into the future. Is this a program that you will have yearly going forward?
Well, we already know, you know, the nurses have been here for a week and a half, and we've seen the success just from stories we're hearing from, you know, the nurses at GMH and also the patients as well. And so we're hoping that this is going to continue on. I know that we have a couple of other islands that are interested in doing the same programs, like the Marshall Islands and Yap and so forth. And we're always willing to train. I think if that's something that I can say about GMH nurses is that's where their strength is. Their strength is in training. Most of them are UOG grads, University of Guam grads, and they were trained well. And now they're continuing to train others as they come through too.
Nice.
So it's such a great partnership.
It really sounds like a great partnership.
Yes.
Again, this partnership hopefully will continue on into the future with other islands as well. But after the break, Jason Solis will go ahead and close out the show with House to Home.